Ever felt like you needed, I don't know, a second mortgage just to pay for your prescription?
Or apps.
Or maybe wondered why getting basic medical care feels like navigating some kind of bizarre, complicated maze.
Yeah, you are definitely not alone in that feeling.
Welcome to the Deep Dive. Today we're diving headfirst into a stack of insights pulled straight from the Consumers.App news aggregator. This is curated from June 4th, 2025.
And our mission today is really to cut through the noise in these headlines. We want to extract the most important nuggets of knowledge about consumer healthcare.
Exactly. Things like those baffling drug prices and, the critical issue of access, not just here, but across different parts of the world, too.
It's a fascinating landscape we're exploring, though. I admit sometimes a pretty frustrating one. We'll be looking at everything from, say, the complex world of drug pricing middlemen here in the U.S.
Right. Wading into those legislative battles.
You're grappling with some significant healthcare disparities and actually some really interesting technological solutions starting to pop up across Europe.
Absolutely.
Yeah.
Consider this your fast track to being genuinely well-informed on some pretty crucial topics that, touch all our lives. We've got a lot to unpack, so let's jump right in.
Okay.
We'll start with a battle that's been brewing over prescription drugs right here in the U.S.
Sounds good.
We're kicking off with a focus driven by a headline from NOLA.com. Inside of the battle over prescription drug prices and pharmacies in the Louisiana legislature. Now, this headline immediately points us toward a really central player, and honestly often an opaque one, in the U.S. drug pricing game. Pharmacy benefit managers, or PBMs.
Right. And what's fascinating here, or maybe concerning depending on your view, is understanding just how much influence these PBMs actually have. The consumers research analysis we're looking at explains that PBMs act as these, powerful intermediaries for health plans.
Intermediaries, okay? So what do they actually do?
They handle pretty much everything in the middle. Managing drug lists, formularies, negotiating rebates with drug manufacturers, processing claims. Essentially, they're the significant link between the manufacturer, the pharmacy, the insurer, and ultimately you.
Wow.
And here's a key point from the source. As of 2023, just 3 of the largest PBMs control a staggering 80% of this market.
80%. Just 3 companies.
80%. That concentration, it gives them immense leverage.
And I guess when you have that much power concentrated right in the middle, questions about transparency and fairness are, they're bound to pop up. Right.
Okay.
That NOLA.com headline highlights legislative action down to Louisiana, specifically mentioning House Bill 264. What's the core idea, the essence of what that bill is trying to achieve?
Well, the goal of House Bill 264, according to the source, is fundamentally about transparency. It's trying to make that opaque middle layer just a bit clearer.
How so?
It aims to mandate that the often significant rebates PBMs negotiate with manufacturers actually go directly back to the employers or health plan sponsors, the ones paying for the coverage.
Instead of potentially being kept by the PBMs themselves.
Precisely. The idea is to try and ensure those negotiated savings flow back into the system, which hopefully eventually benefits the consumers down the line.
Okay, so this focus on rebates and where the money actually goes, that ties directly into the big criticisms leveled against PBMs, which the source also dives into. What are the main concerns being raised?
Well, the criticisms, as reported in the material we have, are pretty pointed. There are arguments that PBMs pocket too large a share of the savings they negotiate. Other concerns include their market power maybe being used to limit drug choices on formularies, sometimes favoring higher-cost drugs if they happen to offer bigger rebates back to the PBM.
Right. That seems counterintuitive for saving money overall.
It can seem that way, and there's just a general lack of transparency about how their pricing and rebate system actually works. The source mentions this has led to, bipartisan criticism and even lawsuits, highlighting just how widespread these concerns are.
It sounds like Louisiana is really trying to, get a handle on this whole situation. Beyond just House Bill 264, are there other ways the state legislature is attempting to regulate PBMs based on the consumer's research analysis?
Yes, the source notes that Louisiana has been exploring additional regulatory measures, too. This includes proposals requiring PBMs to actually obtain permits from the state's Board of Pharmacy.
Okay, bringing them under state oversight.
Exactly, bringing them under state regulatory oversight. It's all part of this broader push to ensure these intermediaries comply with existing state pharmacy practice laws and, operate in a way that's seen as fair to both pharmacies and consumers within the state.
Okay, so for you listening, especially if you happen to be in Louisiana, What could all this actually mean? Like, what's the potential impact on consumers if these efforts are successful?
Well, the hope, as it's detailed in the source, is that increased transparency and regulation could lead to lower prescription drug prices and, importantly, better access for patients in Louisiana.
Any specific examples?
Yeah, it specifically mentions individuals needing those expensive specialty drugs, like ones for diabetes or neuropathy, as potentially seeing significant benefits if these cost barriers can be reduced.
Now, of course, there are usually two sides to any story like this. How do the PBMs themselves justify their role and, push back against these criticisms?
Well, PBMs argue that their negotiation process is actually crucial for securing savings for employers and patients in the first place. They position themselves as essential service providers who manage these complex benefits effectively.
Okay.
Their counterargument, which is highlighted in the source, is that the primary driver of high drug costs isn't really their practices, but rather the high list prices set by the pharmaceutical manufacturers themselves.
So they're pointing the finger back at Big Pharma.
Essentially, yes. They provide value by pushing those manufacturer prices down through negotiation.
It's definitely a complex ecosystem, that's for sure. The source also briefly mentions alternative models aiming to maybe cut out the middleman, like Mark Cuban's cost-plus drugs. What's the basic principle behind that kind of approach?
That model, which is referenced in the Consumers Research Q&A, is based on a much simpler principle, especially when you're talking about generic drugs.
Simpler how?
Remove the layers. Remove the complex negotiations and rebates involving PBMs. Instead, they aim to buy drugs directly from manufacturers, basically at manufacturing costs, and then just add a simple fixed margin.
Ah, the cost-plus idea.
Exactly, a cost-plus approach. Passing that transparent price directly to the consumer, it's presented as a way to bypass the complexity and, the potential opacity of the PBM system entirely, at least for certain medications.
So wrapping this section up, why should you, regardless of where you live, pay attention to a legislative battle over PBMs way down in Louisiana?
Well, because it's a really clear window, isn't it, into how these complex, often invisible systems of middlemen in the U.S. healthcare market can directly impact the price you pay for your medications.
Right. It shows that these state-level fights are often kind of proxy battles for bigger nationwide issues around drug pricing transparency and ultimately affordability.
Precisely.
Okay, let's shift gears now and maybe zoom out a bit. Let's look at the broader issue of high prescription drug prices across the entire U.S. This brings us neatly to our second headline, this one from Forbes. How healthcare providers can help combat prescription drug sticker shock.
Yeah, sticker shock is definitely the right term. This headline gets right to the core of a major problem. The source points to some pretty stark data, including figures from a RAND study illustrating just how much higher U.S. drug prices are compared to other developed nations.
How much higher are we talking?
Overall, U.S. prices were found to be 2.78 times higher. And for brand name drugs specifically, that number jumped to an eye-watering 4.222 times higher on average than in 33 other comparable countries.
4.22 times higher. Wow. That kind of disparity, it really demands an explanation, doesn't it?
It really does.
The Consumers Research analysis breaks down some of the key factors cited for this enormous difference. What are the main reasons the U.S. stands out like this?
Well, according to the source, several factors contribute. The U.S. has very strong patent protections, which can keep cheaper generic competition off the market for extended periods.
Okay, longer monopolies.
Right. And unlike many other countries, there's historically been a lack of direct government negotiation on drug prices for major public programs like Medicare.
So the government can't bargain down prices as much.
Not in the same comprehensive way as in many other places. Add to this the often opaque pricing environment we just discussed with PBMs, and you basically have a system where drug prices can remain significantly higher.
And how do other countries manage it differently?
Well, other countries often use things like centralized negotiation, where the government bargains for the whole country, or external reference pricing, basically, looking at what other nations pay and setting prices based on that.
And this isn't just some abstract economic issue, is it? The impact on American patients must be very real, very significant. What does this sticker shock actually mean for people trying to access the medications they need?
Oh, it has direct and serious consequences. The source cites statistics showing that nearly 1 in 4 Americans struggle to afford their medications.
1 in 4.
And maybe even more tragically, about 30% of patients report skipping doses or rationing their medicine simply because of the cost.
That's dangerous.
It's a critical public health threat, especially for individuals with chronic conditions like heart disease, diabetes, or cancer, where taking medication consistently is absolutely essential for managing their health and preventing serious complications.
So given this huge problem, what are some of the potential solutions being discussed or maybe even implemented to try and tackle this high-cost burden?
The source mentions several approaches. On the policy front, there's the Inflation Reduction Act of 2022.
Right, we've heard about that.
Yeah, which for the first time allows limited Medicare negotiation of prices, but only for a small number of high-cost drugs initially.
So a start, but limited.
A start, yes. Other ideas being explored include that external reference pricing idea, linking U.S. prices to those in other countries, and also potential reforms to patent law to maybe encourage earlier generic entry. It's clear there's a push for systemic change, though it's complex.
And the Forbes headline specifically highlighted the role of healthcare providers. How can doctors, pharmacists, and other providers actually help patients navigate this cost challenge on a more practical day-to-day level?
Yeah, healthcare providers are really on the front lines here, aren't they? The source suggests they can play a crucial role by actively educating patients about cost-saving options.
Like what kind of options?
Well, things like discussing whether a generic version of a prescribed drug is available and, importantly, medically appropriate, or informing patients about manufacturer patient assistance programs. These can sometimes help cover or reduce medication costs for people who qualify financially.
So it's about empowering patients with knowledge.
Exactly, empowering them to make more affordable choices where possible.
The source material also touched on some interesting research and technological angles related to this. I saw mentions of beta regression models and automated drug dispensing systems.
That's right. It shows the depth of the analysis.
How do those fit into this picture of combating sticker shock? It seems a bit technical.
Well, understanding why drug costs are so high and how people use medications often involves some pretty complex data analysis. The mention of beta regression models, for instance, points towards research looking at how different patterns of drug use affect things like health risk scores.
Okay, so understanding the cost drivers better.
Right, helping analysts figure out where costs are going and why. And those automated dispensing systems in pharmacies, the ADDSs, they're more about improving efficiency within the pharmacy itself.
Streamlining things.
Exactly. While not directly lowering drug list prices, they highlight how technology is being used to optimize the system. And that becomes more crucial as the need for medication access grows. It just shows the analytical and technological efforts happening behind the scenes.
So connecting this back to you, the listener, thinking about these factors, the patent protections, the lack of negotiation, the complex pricing, and these potential solutions, how do you think they might impact your own access and cost burden for medications? Are you maybe one of the many struggling to afford what you need?
Understanding why U.S. prices are so different can really change your perspective on the system you have to navigate every day.
It really can. All right, let's shift our focus pretty dramatically now and look across the Atlantic. Our next headline, this one's from the Sunderland Echo, prompts us to consider Europe's healthcare divide. Who is being left behind? This takes us to more of a global perspective, examining healthcare access and equity challenges within Europe.
Yeah, and this headline immediately raises the question of a healthcare divide within Europe, which, is often seen from the outside as having more universal systems.
Oh, you think of universal healthcare.
But the source actually identifies several countries facing significant challenges. It mentions Greece, Portugal, Romania, and Finland.
Interesting mix. What kinds of issues are they grappling with?
It's a mix of distinct, yet sometimes overlapping problems according to the Consumers' research analysis. For Greece and Portugal, they've been impacted by economic constraints and austerity measures that have reduced healthcare spending over time.
Okay, financial pressures.
Right. Romania struggles more with an underfunded system generally and infrastructure deficits, especially outside the major cities. And Finland, despite having generally high standards, faces challenges in ensuring equitable access across its vast and pretty sparsely populated regions.
So geographical challenges and maybe workforce shortages too.
Exactly, often dealing with workforce shortages in specific areas or specialties.
So even with a general goal of universal access, significant disparities clearly exist. The source mentioned something called the European Health Insurance Card, or EACE. How does that relate to healthcare access in Europe? Is it meant to fix these gaps?
Well, the EH uses a key piece for facilitating cross-border access, but it has a pretty specific purpose. The source explains it allows individuals to receive necessary state-provided medical treatment during a temporary stay in another EU country.
So for tourists or short visits?
Exactly, at the same cost as a resident of that country would pay. It's vital for tourists or temporary visitors needing emergency care, for sure, but it doesn't really address the systemic disparities within a country for its own residents or for long-term care needs.
I see. And the source highlights that these disparities are also showing up in biomedical literature, focusing on specific areas.
Yes, the research points to inequities in access to services like home dialysis and mental health care across different European regions.
Why is that?
Well, these disparities are often linked to socioeconomic factors, variations in how regional policies are implemented, and just differing levels of investment in specific service areas. It's definitely not a uniform picture of access across all populations or all types of care, even sometimes within the same country.
It's not all challenges, though, is it? The source also looks at how technology is being deployed to try and address some of these issues, particularly, it seems, in caring for the elderly.
Absolutely. Technology is definitely seen as a crucial part of the potential solution. The source specifically mentions the increasing use of robotics and AI in elderly care.
Robotics in elder care. How does that work?
These technologies can assist with daily tasks, provide health monitoring remotely, and even offer a degree of companionship. The goal is to help older populations maintain independence and quality of life, especially as Europe's population overall is aging.
That's fascinating. And there was another interesting technology mentioned, federated learning, even in the context of the metaverse. That sounds very futuristic. How might that fit into enhancing healthcare services?
Yeah, that points to the real cutting edge of data management in healthcare. The source explains that federated learning basically allows health data to be analyzed across multiple devices or institutions without the sensitive data ever leaving its original secure location.
So it protects privacy while still allowing analysis.
Precisely. It greatly enhances privacy and also scalability for analyzing really large data sets. Its application, even in futuristic contexts like the metaverse, just shows how secure distributed data analysis is seen as a way forward to improve diagnostics, personalized medicine, and research, all while protecting sensitive patient information.
We talked earlier about the consequences of high drug costs in the U.S. What are the specific socioeconomic impacts of these unmet medical needs within Europe?
Well, the source outlines several pretty significant consequences. Unmet medical needs obviously lead to worsened health outcomes for individuals,
Right.
which in turn can actually increase healthcare costs in the long run as conditions become more severe and harder to treat.
Makes sense.
There's also a loss of productivity for both the individuals affected and the wider economy, as people are less able to work when they can't access the care they need. And crucially, it perpetuates social inequalities because it disproportionately affects low-income populations and those living in rural or underserved areas who already face greater barriers to accessing care in the first place.
Finally, on this topic, the source mentions specific measures proposed to improve access to home dialysis, since that was highlighted as an area of disparity. What kind of measures?
Right. To address that particular inequity, some measures suggested in the source include things like auditing financial disincentives that might unintentionally discourage home dialysis,
Okay.
encouraging professional medical societies to actively promote home-based therapies, expanding access to assisted peritoneal dialysis for those who might need extra support, and supporting patient advocacy efforts to push for better policies and resources.
So even if you're not living in Europe, what do these challenges and these technological solutions tell us about the broader, maybe universal issues in healthcare?
Well, I think it highlights the challenges of cost, access, equity, and workforce. They exist in various forms pretty much globally, don't they?
Yeah, seems like it.
And it also shows that technology, whether it's practical robotics for elder care or advanced data analysis like federated learning, is increasingly being viewed as a key part of future solutions everywhere.
Let's drill down even further into that European picture for our final headline. This one's from Euronews via MSN.com. Unmet medical needs. Which countries in Europe are struggling the most to provide healthcare? This gives us some really concrete data on where those access issues are most acute.
Yeah, this headline provides specific data points that, frankly, really underscore the problem. According to the source, Estonia reported the highest proportion of self-reported unmet medical needs back in 2023.
How high?
15.5% of people aged 16 or over indicated they needed medical care but didn't receive it.
15.5%. That's high. What were the main reasons cited?
Primarily, long waiting lists and the high cost of care. Other countries like Greece and Finland also face significant issues, with Greece actually having over 21% affected due to systemic problems.
Wow. That high percentage in Estonia is striking. And the reasons waiting lists cost, they sound pretty familiar, actually. The analysis also points out that unmet needs vary significantly depending on someone's income level. How does that play out?
Yeah, this is a really crucial point. The source consistently shows that unmet needs are higher among lower income groups right across Europe. It uses Spain as a clear example.
How so?
Well, even though Spain might have relatively low overall unmet needs compared to some others, there's still a significant gap in access to things like dental care between wealthier and poorer populations.
And why is that gap there?
It's largely attributed to out-of-pocket expenses. It just powerfully illustrates how financial constraints remain a major barrier to care, even in systems that are aiming for universal access on paper.
So which specific types of health services tend to be most often affected by these unmet needs across the EU?
Dental care comes up again and again as one of the most problematic areas. The source explicitly states that in 23 out of 27 EU countries, the cost of dental care was the main reason people couldn't access it.
23 out of 27. Because of cost.
Yes. And mental health care is another service area facing high unmet needs, particularly in countries like Estonia, Finland, and Poland. The main reason there seems to be that the demand for services significantly outstrips the available capacity.
Not enough providers or resources.
Exactly.
This really underscores the critical role of how healthcare is publicly financed, doesn't it? How does public funding influence these unmet needs figures?
Public financing is absolutely key. The source highlights contrasts. In Spain, for example, certain exemptions within the public system help protect vulnerable households from crippling healthcare expenses.
Okay.
However, in countries where public funding for services like dental or maybe optical care is limited, which leads to high out-of-pocket costs for patients, you see predictably higher levels of unmet needs specifically for those services.
So it shows that where the public system actually covers the costs, makes a direct difference in who gets care and who doesn't?
Absolutely, a direct correlation.
The source also touches briefly on the legislative landscape in the EU regarding healthcare access. What does that tell us? Is there much EU-wide legislation?
It suggests that while there are overarching EU regulations like those for diagnostics and medical devices aimed at ensuring quality and availability across borders, specific EU-level legislation directly targeting broad, unmet medical needs as a concept is actually quite limited.
Interesting.
The source notes, for example, a particular lack of harmonized incentives across the EU for developing medical devices specifically for rare diseases. And that lack of incentive can contribute to unmet needs for patients who require specialized equipment.
So it highlights areas where maybe more EU coordination could help drive access.
Potentially, yes. It shows where coordination is present and perhaps where it might be lacking.
Finally, the analysis looked at predictors of unmet needs among specific groups, like cancer survivors. What factors make them more likely to have unmet care needs even after treatment?
Yeah, for cancer survivors, the source indicates that unmet needs often relate to needing more information, maybe about signs of recurrence, or just help managing the complexity of their ongoing care team.
Okay.
Dealing with the psychological and physical long-term effects of treatment also contributes significantly. And predictors also include those socioeconomic factors again, like income.
Still comes back to money sometimes.
It reinforces that even post-treatment financial resources significantly impact whether survivors can actually access the follow-up care and support they really need.
So looking at these specific challenges in Europe, the waiting lists, the cost barriers, the disparities in services like dental and mental health.
Yeah.
How do they compare or maybe differ from healthcare access issues you might see in your own community or country? It really makes you consider the universal nature of the struggle to provide equitable and affordable healthcare, doesn't it?
It absolutely does. Different systems, similar struggles in many ways.
We've taken quite a deep dive today, haven't we? Through the insights from the Consumers.App news aggregator for June 4th, 2025, exploring this multifaceted world of consumer healthcare.
We really have. We've seen how the complex dynamics of drug pricing middlemen play out in the U.S.
Right, those PBMs in Louisiana.
Stark comparisons of prescription costs globally and the distinct, but also, as you said, universal challenges and emerging technological solutions within European healthcare access.
We've definitely uncovered some common threads. Cost barriers are huge.
Yeah.
The critical importance of access and equity.
The impact of systemic structures like PBMs and that increasing role technology is expected to play, whether it's through legislative efforts, innovative research, or just practical applications in care delivery.
Yeah, it's clear that healthcare is such a dynamic space with really significant implications for consumers everywhere.
It certainly is.
Absolutely. It's been incredibly insightful to unpack these different pieces of the puzzle today and see how interconnected they really are, even across continents. Thank you so much for joining us on this deep dive.
And we hope this discussion has provided you with some valuable perspective on the critical issues shaping consumer healthcare right now.
And hey, if you found this valuable, make sure to like and subscribe Consumers 360 wherever you get your deep dives.
Please do.
Before we wrap up, here's a final thought for you to ponder. Given all the challenges for today, from PBM transparency and U.S. drug prices to Europe's access disparities and the growing role of technology, what single change do you think could make the biggest or positive difference in healthcare access for consumers, no matter where they happen to live? Something to think about.